Good morning, everybody. Thank you, Mr. Chairman, for your introduction. Thank you for being here. I'm honored to share with you our first data on a case control study on outcome of children who antenatally have been exposed to chemotherapy. It's based on work within the framework of the International Network on Cancer, Infertility and Pregnancy, which is actually a European initiative that has now broadened towards a worldwide initiative where since 2003 we focus on the topic on cancer in pregnancy. It's online available, cancerinpregnancy.org. Actually, we have published the first results in Lancet Oncology about 2 years ago on the outcome of children who have been exposed antenatally to chemotherapy. The results actually were reassuring. However, there were two limitations. One is that at that stage it was only a descriptive group, so the outcome was compared to normative values, and the group as such was quite heterogeneous. So we had children of 18 months and we had children or youngsters from 18 years old. So we hope to improve this, and we set up a case control study. We merely wanted to broaden the group, but also to look for controls, and we did limit the study to children 18 months or 42 months of age. What we do at that stage is a Bailey scales of infant development. We used the second edition, and we also did an electro and echocardiography. The results, we have 38 children, median age of 20 months, ranging from 80 to 42 months, and 38 controls, all assessed by this Bailey scale. We had an echocardiography in 24 children. We do not have echocardiography in all 38 because doing an echo of the heart in a child of 18 months is not so easy because the child is just moving the whole time. Most frequently, maternal cancers were breast cancer in 61% and hematologic cancers in 22%. Chemotherapy consisted on average on 4 cycles of chemotherapy with a range of 1 to 7 and 3 different types with a range of 1 to 5. In fact, more than one type of chemotherapy was administered in 91 cases. Here we see the cardiac data. We will not go into detail, but what we see at the left are actually different parameters that echocardiographists are using in order to assess the health, the function of the heart. And we see the study children here, control children, and we will not go into detail into the numbers, but what I can tell you, we see some differences, but never these differences are clinically relevant. So if we discuss this with cardiologists, for them these results are reassuring. This is the most important slide. We see right at the top, we see the proportion of children and their outcome, their mental developmental index. In orange, we see the control group, in blue, the study group, and in fact, there is a nice overlap between these two. We could not see any difference in Bailey scale development in children antenatally exposed to chemotherapy or not. At left, here, we see actually again in blue, the study group. Here the results are compared, the mental development index is compared to the gestational age. And there we see that children who are antenatally born are in fact doing a bit worse when compared to children who are born term. But the most important message is here that this is the same for children who have been exposed antenatally to chemotherapy or not. So prematurity is a problem, but not chemotherapy. And at the right here, we see the mental developmental index compared to the numbers of chemotherapy cycles that are administered. And at the left, we see 1 or 2 cycles of chemotherapy. At the right, we see 5, 6, or 7. And actually, the results are the same. So whether you give 1 cycle of chemotherapy or 7 cycles of chemotherapy, for the child's development, this does not make a difference. So what are the clinical implications of our study? We feel that the fear for chemotherapy should not be a reason to terminate the pregnancy. The fear for chemotherapy should not be a reason to delay maternal cancer treatment and jeopardize her outcome. And we should use actually chemotherapy to avoid iatrogenic premature delivery because prematurity is a problem, chemotherapy not. Thank you very much.